everyone, Dr. Mike here. Today, I want to talk to you about something that could truly make a difference in your life or the life of someone you care about. Strokes are a medical emergency that can strike suddenly. But did you know that your body often gives you warning signs, sometimes even weeks in advance? Recognizing these early signals can be the key to preventing a devastating outcome. Today, we're diving into a topic that could save your life: strokes. Every year, nearly 800,000 people in the United States experience a stroke, and many of them never saw it coming. But what if you could spot the signs before it's too late? That's exactly what we're here to discuss. We're covering 7 warning signs that can appear even a month before a stroke strikes. These symptoms can be subtle or easy to dismiss, but paying attention to them could be life-saving. From sudden numbness or weakness, especially on one side of the body, to unexplained confusion or trouble speaking, these are not things to ignore. Strokes don't discriminate. They can happen to anyone, regardless of age, gender, or how healthy you think you are. While risk does increase with age, strokes are increasingly affecting younger adults too. That's why it's so important for everyone to be aware of the warning signs, not just those who consider themselves at risk. Stroke is a leading cause of death and disability in the US, and it can leave survivors with lasting physical and mental challenges. But the good news is, knowing the signs and acting quickly can dramatically improve outcomes. The sooner you get help, the better your chances of recovery. If you or someone around you experiences any of these symptoms, seek medical attention immediately. Don't wait to see if the symptoms go away. Call 911 or your local emergency number right away. Quick action can mean the difference between a full recovery and permanent disability. Time is brain. Every second counts. When a stroke happens, millions of brain cells die each minute. That's why it's so important to act fast. The faster you get treatment, the more brain function you can save. We'll break down each warning sign and explain why quick action matters. You'll learn what to look for, how to respond, and why you should never ignore these symptoms, even if they seem to go away on their own. Watch until the end and share this video. You could help save a life. By spreading awareness, you're not just protecting yourself, but also your loved ones and your community. Let's get started and empower ourselves with the knowledge to act fast when it matters most. Let's start with a major risk factor for stroke and heart disease: high blood pressure, also known as hypertension. It's a condition that affects millions of people worldwide, often without them even realizing it. In fact, it's estimated that nearly half of adults with high blood pressure don't know they have it. That's because hypertension rarely causes obvious symptoms, especially in its early stages. You might feel perfectly healthy, but inside your body, something dangerous could be happening. High blood pressure is often called a silent killer for a reason. It quietly damages your blood vessels and vital organs over time, without giving you any warning signs. This means that by the time you notice a problem, significant harm may already have occurred. The only way to know for sure if your blood pressure is high is to have it measured regularly. When your blood pressure is consistently high, it puts extra strain on the walls of your arteries. Over the years, this constant pressure can cause the arteries to become narrow, stiff, or even rupture. The inner lining of your blood vessels can get damaged, making it easier for fatty deposits or plaque to build up. This process, called atherosclerosis, makes it harder for blood to flow freely and increases the risk of clots forming. These changes in your blood vessels are what make high blood pressure so dangerous. There are 2 main types of stroke that can result. The first is ischemic stroke, which happens when a blood clot blocks an artery in the brain, cutting off blood flow. The second is hemorrhagic stroke, which occurs when a weakened blood vessel bursts, causing bleeding in or around the brain. Both types can lead to serious, life-altering consequences, and both are strongly linked to uncontrolled high blood pressure. High blood pressure is a key player in both types of stroke. It's one of the most important risk factors, and it's something you can actually do something about. By understanding your numbers and taking steps to control them, you can dramatically lower your risk of having a stroke or developing other serious health problems. The tricky part is that you can't rely on how you feel to know if you have high blood pressure. Most people with hypertension feel completely normal, even when their blood pressure is dangerously high. That's why it's sometimes called a silent threat. It can sneak up on you without any warning. The only way to catch high blood pressure early is through regular checkups. Make it a habit to have your blood pressure checked at every doctor's visit, or even at home with a reliable monitor. Early detection gives you the best chance to take action before any damage is done. Managing your blood pressure is crucial for protecting your health. This means making healthy lifestyle choices every day. Eat a balanced diet that's low in salt and rich in fruits, vegetables, and whole grains. Get regular physical activity. Aim for at least 30 minutes most days of the week. Maintain a healthy weight. And if you smoke, make a plan to quit. Even small changes can make a big difference over time. For some people, lifestyle changes alone aren't enough to control blood pressure. In these cases, medication may be necessary. Your doctor can help you find the right treatment plan, and it's important to take your medication exactly as prescribed. Never stop or change your medication without talking to your healthcare provider. Taking control of your blood pressure is one of the most powerful things you can do for your long-term health. Don't ignore this silent threat. Know your numbers, track your progress, and work with your healthcare team to stay on top of your health goals. Remember, even if you feel fine, it's important to get your blood pressure checked regularly. High blood pressure can affect anyone, regardless of age, gender, or how healthy you appear on the outside. Community screenings, workplace wellness events, and pharmacy checks are all great opportunities to stay informed. Prevention is always better than treatment. By staying proactive and making healthy choices, you can protect yourself and your loved ones from the devastating effects of stroke and other complications. Encourage your family and friends to get their blood pressure checked too. It could save a life. Protect your brain, your heart, and your future by keeping your blood pressure under control. Take action today. Your health is worth it. We all get tired, but sudden extreme fatigue can be a warning sign of stroke. This isn't just being sleepy. It's overwhelming exhaustion that hits out of nowhere. It can signal your brain isn't getting enough blood flow. Sometimes this fatigue is a symptom of a transient ischemic attack, or TIA, a mini-stroke. TIAs are serious and often precede a major stroke. Causes include narrowed arteries, blood clots, or even an aneurysm. If you experience sudden, severe fatigue without explanation, don't ignore it, especially if it comes with weakness, numbness, dizziness, or vision problems. Talk to your doctor right away. Sudden changes in vision are a major red flag for stroke. Watch for blurred vision, double vision, or sudden loss of vision in one or both eyes. These issues happen when blood flow to the brain's visual centers is disrupted. Think of your eyes as cameras. If the brain can't process the images, your vision suffers. Don't wait to see if it gets better. Call 911 or get to the ER immediately. Early treatment can minimize brain damage. Vision changes can be the first sign of a stroke. Take them seriously and act fast. Headaches are a common part of life for many people, often caused by stress, dehydration, or lack of sleep. But sometimes, a headache can be much more than just a temporary discomfort. If you suddenly experience a headache that is extremely severe, especially if it feels unlike any headache you've ever had before, it could be a warning sign of a serious medical emergency, such as a stroke or a ruptured brain aneurysm. These conditions require immediate attention, and recognizing the difference can be life-saving. People who have suffered a stroke or aneurysm often describe the pain as the worst headache of their life. This type of headache usually comes on very suddenly, reaching maximum intensity within seconds or minutes. It's not the kind of pain that gradually builds up over time. It's abrupt, overwhelming, and can feel like a thunderclap inside your head. If you ever experience this, it's important to take it seriously and seek help right away. These headaches are often described as being extremely intense and are frequently located at the back of the head or neck. You might feel a sudden, sharp pain that radiates down your neck or even into your shoulders. This is different from the typical tension headache or migraine, which usually has a more predictable pattern and location. In addition to the severe pain, these headaches are often accompanied by other alarming symptoms. You might feel nauseous or actually vomit. A stiff neck, confusion, trouble speaking, or difficulty understanding others can also occur. Some people may even lose consciousness or have trouble staying awake. These are all red flags that something serious is happening in your brain. If you or someone around you experiences a sudden, severe headache, especially with any of these additional symptoms, don't hesitate. Call 911 or your local emergency number immediately. Time is critical in these situations, and getting medical help quickly can make all the difference in the outcome. It's natural to want to wait and see if the pain goes away, or to try to tough it out, but this can be a dangerous mistake. Ignoring these warning signs or delaying treatment can lead to permanent brain damage or even death. Every single minute counts when it comes to treating strokes and aneurysms. The faster you get to the hospital, the more likely doctors can intervene and prevent long-term damage. Emergency teams are trained to respond quickly and provide the care you need. Recognizing the difference between a typical headache and a true medical emergency is crucial. Your quick action could save your own life or the life of someone you care about. Don't second-guess yourself. Trust your instincts and get help fast. Remember, never ignore a headache that is sudden, severe, and unlike anything you've felt before. When in doubt, always err on the side of caution and seek emergency care. Sudden numbness or weakness, especially on one side of the body, is a classic stroke symptom. It can affect the face, arm, or leg, and may be accompanied by tingling or loss of coordination. These symptoms happen because a stroke disrupts signals between your brain and body. Even if similar symptoms can be caused by other conditions, don't take chances. If you notice sudden numbness or weakness, seek medical help immediately. Fast action can make all the difference. Sudden trouble with speech or language is a common stroke symptom. Watch for slurred speech, trouble finding words, or difficulty understanding others. These issues happen when a stroke affects the brain's language centers. It's like a glitch in your brain's communication system. If you or someone else suddenly can't speak or understand speech, call 911 right away. Don't wait to see if it improves. Immediate help is critical. Some stroke warning signs are subtle, like sudden confusion, memory loss, or loss of balance. Sudden nausea or vomiting can also be a sign, especially if it comes with other symptoms. These changes mean your brain isn't getting the blood it needs. Don't dismiss these symptoms even if they seem minor. If they come on suddenly, get medical help fast. It's always better to be safe. Those are the 7 warning signs of stroke you should never ignore. Acting quickly can prevent long-term damage and save lives. Share this video to spread awareness and help others stay healthy. Subscribe for more health tips and let us know your experiences in the comments. Thanks for watching. Stay healthy.